I have bipolar disorder, and a lot of people talk to me about their psych meds like I'm the expert. And honestly, I get it. I've taken a lot of meds over the years. Trying a new bipolar med can be scary. It feels a little like taking a pill from Alice in Wonderland. So if you just got prescribed Depakote, Tegretol, or Lamictal, you might be wondering, why is my doctor prescribing a seizure med for bipolar disorder? There's actually a really interesting connection between epilepsy and bipolar disorder. Even though I've never had a seizure myself, I have tried most of the anticonvulsants they prescribe for bipolar disorder. Today, I'm going to be talking about the connection between epilepsy and bipolar disorder, why we use seizure meds for bipolar disorder, how they work, side effects, my personal experience with these meds, and what you can expect if you've been prescribed Depakote, Tegretol, or Lamictal. I'll also talk about some of the lesser used anticonvulsants like Gabapentin, Topamax, and Trileptal that are sometimes used off-label. So let's get into it. I'm Patty, the girl with blue energy. I have bipolar disorder and I make videos about mental health and personal growth. Let's start by talking about the connection between epilepsy and bipolar disorder. They are two totally different conditions, but they share something in common. Both conditions involve abnormal electrical signaling. They're not exactly the same, but they have similar patterns. One thing we do know is that they often co-occur. So people with bipolar disorder have higher rates of epilepsy than the general population, and people with epilepsy have higher rates of mood disorders. Here's a quick explanation. Our brains communicate using tiny electrical signals. These signals happen because ions like sodium, calcium, and potassium move in and out of brain cells through ion channels. These channels control how fast or slow the brain cells fire. In epilepsy, these cells can start misfiring, sending too many signals too fast. The cell's overexcited firing is what triggers a seizure. Anticonvulsants work by calming down and stabilizing that electrical activity. So that explains what's going on in the brain of someone with epilepsy. But what does that have to do with bipolar disorder? Why do we use seizure meds to treat bipolar disorder? Researchers started looking into anticonvulsants for bipolar disorder back in the 1960s and 70s. A French and German study showed that Depakote had a calming effect on patients and appeared to reduce their manic symptoms. Around the same time, epilepsy research led to something called the Kindling theory. Neuroscientists were studying epilepsy in animals by stimulating certain parts of the brain with low-level electrical pulses, levels that were too low to stimulate a seizure normally. But over time, with repeated stimulation, these animals started having seizures. This is what led researchers to propose the Kindling theory. The Kindling theory goes something like this. Repeated small stimulations can accumulate and lower the brain's threshold for seizures so that a seizure can be triggered more easily. The more seizures the animal had, the less stimulation was needed to cause the animal to have another one. Later, psychiatrists started to see the same sort of patterns in bipolar disorder, which led to the concept of the Kindling theory for bipolar disorder. So the idea of the Kindling theory for bipolar disorder is this, that early on in the illness, it takes a major stressor to trigger a manic episode or a depression episode. But the more manic and depression episodes you have, the less is needed to trigger one. Sometimes you can be triggered to have a manic episode with very little stressors at all, or sometimes not at all. And this concept of the Kindling theory kind of explains why as you progress with the disorder, you start to see rapid cycling. So when psychiatrists started to see the connection between epilepsy and bipolar disorder and that it had a calming anti-manic effect, that's when we started using anticonvulsants to treat bipolar disorder. Anticonvulsants help people with bipolar disorder for the same reason they help people with epilepsy. They calm down the electrical activity in the brain, which is what's thought to cause the manic episodes and mixed episodes. Some anticonvulsants work better for mania, and some work better for depression. So let's talk about the anticonvulsant that you might be taking. Before I get into the meds, Depakote, Tegretol, Lamictal, and some of the others, let me make sure I'm really clear on this. I am someone with bipolar disorder. I'm not a doctor, and I'm certainly not a pharmacist. So don't take any of this information as medical advice. Make sure you talk to your doctor about any medication you're taking. This is just general information on the meds that I hope to provide for you guys and some of my own personal experience with taking some of these meds. Now that that's out of the way, let's start with Depakote. Depakote is often used when lithium doesn't work for you. Depakote might be the next thing they try. It was the second med I tried. So Depakote is generally used to treat the mania and the mixed episodes. It can also be used for anger and irritability symptoms. It is not generally used to treat the depression side of bipolar. So if you take Depakote, you may need to take another medication along with it. When you start on Depakote, they usually start you on a lower dose and then gradually bump that up. This may take as long as 6 weeks for you to notice a difference. Sometimes you'll notice something as early as 1 or 2 weeks. Some common side effects you might experience with Depakote include weight gain, sedation, tremors, hair thinning, GI symptoms like nausea or stomach issues, and sometimes appetite increases. When you take Depakote, your doctor may monitor your blood levels and they may check your liver function and platelets. Depakote was one of the first bipolar meds I took. I took it after they had tried me on lithium at too high of a dose, and so then they tried me on Depakote, and I didn't have a very good experience with Depakote either. I had a lot of nausea and vomiting with it, so I didn't take it long enough for me to tell you how effective it is. I just know that they do use Depakote and some of the other epilepsy meds for bipolar a lot, and a lot of people use it in conjunction with another medicine. Tegretol is one of the older anticonvulsants, and a lot of times doctors will put you on Tegretol after you've tried lithium and Depakote and those didn't work for you. Like Depakote, it helps with manic episodes and mixed episodes, and it's sometimes used with rapid cycling. It's more used to treat the mania than the depression. Tegretol can start working in a week or two, but most people need 3 to 6 weeks to reach the full effect. And your doctor will likely monitor your blood levels as they change your dosage on Tegretol. So it may take several weeks before you can tell whether or not it's helping you. And like the Depakote, you may need to be taking it with another medication because it mainly treats the mania and the mixed episodes, not so much the depression. Some side effects you might experience with Tegretol include dizziness, drowsiness, or nausea. You can also experience blurred vision or low sodium levels. So if you're taking Tegretol, your doctor is going to be checking your blood levels, and they may also monitor your liver function and your sodium levels. This drug is known for having drug interactions, so your doctor will probably check to make sure that you're not taking another med that could be a problem with this one. I'm pretty sure that I've taken Tegretol as well. I think I've taken all of the anticonvulsants, or all the major ones. I don't totally remember my experience with this one, but I do believe that I had nausea and issues with my stomach when taking this one, so I never stayed on this long enough for me to really tell you how much it does or doesn't help with bipolar disorder. So the last one is Lamictal, and Lamictal is used a lot for bipolar disorder. In fact, I think it's one of the more used medications for bipolar disorder. And unlike the other two meds, Lamictal helps with bipolar depression and not just the mania. In fact, it helps more with the depression and not as much with the mania. So if you take Lamictal, you may have to take another med to help with the hypomania or the mania. Lamictal takes a little longer for you to notice difference. It takes about 4 to 6 weeks for people to notice any effect on their mental health, and then more like 6 to 12 weeks to experience the full effect from it. So it may take some time for you to know if this med is actually helping you or not. Some of the common side effects you might experience if you're taking Lamictal include headache, dizziness, nausea, and insomnia, or just feeling wired. The biggest thing to watch for when you take Lamictal is a rash. They start you on a really low dose of Lamictal and gradually increase it because this rash can be a sign of a very serious life-threatening condition called Stevens-Johnson syndrome. So if you notice any rash at all when you start taking this, you need to report that to your doctor right away. Now I'm going to tell you my weird experience with Lamictal, and I'm partially telling you it because I've had issues with medications giving me weird side effects that are like on the rare, you shouldn't see this very often list. So I'm mentioning it for two reasons. One, to let you know that some bipolar meds have these rare side effects, and some of us tend to experience them more often than others. But I had what I thought was a bladder infection. I went to the doctor and I kept going to see the urgent care because I thought I had a urinary tract infection because I was having this really painful urination. Well, it turns out this is like a really rare side effect from Lamictal, because when I talked to my psychiatrist about it, that's when they decided that I needed to go off of the Lamictal. It's not something you'll see if you just like Google it and look for the symptoms. It's more in the case reports. So some of these weird side effects do happen, and I've experienced them. Lamictal was one of those meds that I had high hopes for, but I wasn't able to take it very long because of that. I didn't have problems with the rash or the life-threatening stuff, but I still had to go off of it. So my experience with anticonvulsants have been that I've had side effects with almost all of them, and none of them really helped me with my bipolar, but I also didn't take them long enough to really know what kind of impact they could have had. There are 3 other anticonvulsants that are sometimes used off-label for bipolar disorder. However, these meds are not listed as bipolar meds, and there's no evidence that they actually help with the mania or the depression in bipolar disorder. They're usually used as add-ons to help other symptoms that may go along with bipolar disorder. Gabapentin is one of them. It's sometimes used for anxiety, sleep, or pain, which sometimes goes along with having bipolar disorder. We are at a higher risk of having chronic pain just because we have bipolar disorder. So this one may be used in conjunction with one of your other meds if you're having issues with pain and sleep. Topamax is another one. They usually prescribe it for migraine, and that's something you often see along with bipolar disorder. People with bipolar are more inclined to get migraines, so they will sometimes prescribe Topamax for migraine treatment. I've tried this myself because of my migraines and bipolar, and my doctor basically explained that it would help me because it's an anticonvulsant. It may help a little with the bipolar, but it may help my migraines. I wasn't able to take it very long because I started having weird eye floaters from it. Like I said, I get weird side effects from a lot of these meds, so Topamax may be one they might prescribe if you get migraines. Trileptal is the third one, and sometimes they'll use Trileptal if you didn't respond to Tegretol. It's a little bit gentler than the Tegretol, but if you take this, it may not be effective enough, and you may need to take it with another medication. I hope you guys found this interesting. I had never heard of the Kindling theory of bipolar disorder before I started researching this, and it explains so much about my own rapid cycling experience. It also makes it really clear why it's so important to reduce the number of manic episodes you experience, because if you experience more manic episodes, your brain becomes more reactive and responsive to them. There are a lot of interesting parallels between epilepsy and bipolar disorder, and understanding them helps to understand more about the meds we take and why we take them. Thanks for listening, guys. Be sure to hit the like button and, of course, subscribe. I'll see you guys again soon.